Hi there, Kristen Galloway here, licensed occupational therapist and certified dementia care specialist. Welcome back. I have had several requests recently in the comments on my videos and also from a couple of in-person clients that I work with to talk about refusal of care. And so individuals with dementia, it's very common for them to refuse care, particularly with bathing or grooming or changing their clothes. This is a very common occurrence, and it's very frustrating for caregivers. What can we do about this? Now, as many of you may know, no amount of coaxing or pleading will get the person to cooperate. And of course, forcing them to do it can lead to combative behaviors, which is always dangerous. It can also lead to increased anxiety for both the person with dementia and for caregivers. And I think it's really important to remember that while the person with dementia may not remember the specific situation, the specific scenario that occurred, they will remember how it made them feel. So I think that probably is one of the reasons that this refusal seems to perpetuate. They tend to focus on one or two tasks that they absolutely don't want to do. And in my experience, a lot of that refusal stems from kind of a pattern, right? They started to refuse it at one initial point in time, and because it was a dramatic situation or a lot of anxiety associated with that, they continue to refuse because they remember how that made them feel. So this is a slippery slope, right? So we don't want to encourage those negative feelings because they can get in the way of us trying to help them and provide care for them. So I have 6 simple strategies I'm going to go over today to help overcome refusal of care. But before I dive into those 6 strategies, I want to share with you that I have a brand new dementia caregiving course coming out. I'm so excited to finally release it. I've been working on it for several months, and I'm super excited to share it with you. Registration is going to open on January 22nd of 2023. So if you look below this video in the description, I posted a link to the pre-registration page. If you go click that link and put in your name and email address and pre-register, you will receive the course at 50% off of the offering price going forward. So go ahead and pre-register, even if you're kind of not sure if that's something that you want to do. That way you'll have the ability to purchase the course at a discounted price when the registration opens, and you can decide at that time on the 22nd. Okay, let's dive right in. So 6 simple strategies to overcome refusal of care. Number 1, all of us as human beings tend to like habits and routines. And so my first big recommendation is to stick to their habits. So this can be hard, right? So their habit may have been to get up and take a shower first thing in the morning and then get dressed and have their cup of coffee. Well, maybe we as caregivers can't provide the shower, the bath, or whatever the task is on their typical time schedule. Maybe we can only come over after work, or maybe we can only come over and do it at lunchtime. And that's a legitimate concern, but I would advise, if you possibly can, to try to stick to the habits and routines that they've created their entire lives. It's going to make getting their cooperation and participation in the task that much easier. So if we have an individual who has always done something the very same way, we try to keep as much of the routine or as much of the task exactly the same as it always has been, and that will make it easier to get them to participate. So even if you can't do it at the same time of day, using the same bathing area, the same bathroom, right? So don't try to switch from the master bathroom to a different bathroom, even if it has, a bathtub instead of a shower or whatever. Try to stick to the same routines. All the way down to, the brand of shampoo and literally everything that you can make the same, make it the same, and it's going to make your life a lot easier. Okay. Number 2, don't rush. And I know this is a really tough one. As caregivers, we have a ton to get done and very little time to get it all done. But if you can, slow the process down, allow extra time, and be patient. A lot of individuals with dementia have a really difficult time processing verbal commands, right? So if you ask them to do something, it's going to take a little while. And this is called latency. It takes a little while for them to kind of process what you're asking them to do. and then respond to it. So there's a lengthened amount of time for them to respond to your request. So slow down. And because if you do rush them through the task, it's just going to create anxiety for you and for them. And then they're going to kind of push back and maybe even shut down altogether. Okay. Number 3, one step at a time. So we can easily overwhelm the person with dementia by kind of saying, first we're going to do this, then we're going to do this, then we're going to do this, and kind of giving them the big picture. That's the last thing they need. The easiest way to get them to participate in a cooperative way is to say, first, unbutton your shirt, right? Take this arm out. Okay, now we're going to take this arm out. Now we're going to get the washcloth, right? Then the next step, we're going to put a little bit of warm water on the washcloth. So literally, we're going through the process. Really break it down as simply as you possibly can, and that will make it that much easier for them. They don't want the big picture. They need just one step at a time. What do you need them to do right this minute? Okay, perfect. So the number 1, 2, 3, this is number 4. Consistency is key. And we kind of touched on this a little bit when we said kind of stick with their habits, but consistency would be doing the task at the same time, in the same location, the same sequence or way of doing the task, and with the same person, with the same helper or caregiver every time, right? That's just going to make it that much easier for them to get used to it and to help create that habit or create that as part of their routine. It will decrease resistive behaviors for sure. Number 5 is to simplify the task. So the fewer decisions that the person with dementia has to make, the easier this task is going to be for them. So this is going to vary, obviously, by kind of what level of dementia they're at, or how much of a difficult time they're having with this task. But you can modify the number of decisions that they need to make so that, let's just talk about picking out an outfit. So we have the highest level would be have the whole entire closet full of clothes, just kind of all in there, shirts, pants mixed together, whatever. So that's super, super tough. The next level would be we have all the shirts in one place, all the pants in one place, right? Then we can just, or skirts, whatever, and then we're just picking 2 things. The next level would be to have only 2 or 3 outfits hung in the closet. So just a couple of shirts, a couple of pairs of pants, and maybe a jacket, so that they have fewer options that they have to think through. And then we could break it down even more. We can kind of pre-select outfits. So hang a shirt and a pair of pants together here, another shirt and a pair of pants, and another shirt and a pair of pants. So they have something already matched up, and they just have to grab those 2 side-by-side items and get them out of the closet. And then the lowest level would be to go ahead and pre-select the entire outfit for them. So you have a shirt and a pair of pants picked out, already laid out in the bathroom. They don't even have to look into the closet. So that's kind of the hierarchy of how you would break it down, and obviously allowing them as much choice as possible, but keeping it simplified to a level that is easy for them to manage. Okay? And the last one, and I realize that this may be out of reach for some people, would be to hire a caregiver to perform the task that the person is refusing. So sometimes, not every time, but sometimes having a hired caregiver come in just to do a bath a few times a week, or once a day for a couple of hours, just to help with that morning routine of grooming and getting clean clothes on. Sometimes that is just the thing that you need, because a lot of times individuals with dementia, not everyone, but a lot of times, they maintain a certain level of respect for and cooperation for someone who is kind of wearing a uniform, so to speak. So this, and by this I mean a healthcare professional or a hired caregiver, or someone who comes in from the outside, isn't a personal relationship with them. It isn't someone in their family, isn't a caregiver that's already taking care of them, but someone new who's coming to the situation and just comes in to do that one task with them. Sometimes, not all the time, but sometimes that can make it easier. And I do realize that there are financial considerations and some people can't do that, but it is a recommendation that I have seen work for some families. So those are my top 6 simple strategies to help with refusal of care. Give them a try. Let me know if you found anything that worked for you. I'd love to hear your comments. So drop me a comment below. Give me a thumbs up if you enjoyed this content and found it valuable. And of course, subscribe to the channel so that you don't miss any future videos. Thanks so much for watching.